Welcome to Chapter 7, Part 1, Microscopic Examination of Urine Sediment. This presentation is broken down into many parts due to the length of the chapter. Some of you don't have very good internet access, so by having these in smaller pieces decreases the download time. The standardized quantitative microscopic examination of urine sediment made its clinical laboratory debut in 1926. At that time, Thomas Addis developed a procedure to quantitate the formed elements in a 12-hour overnight urine collection. The purpose of this test, the Addis count, was to follow the progress of renal diseases, particularly acute glomerulonephritis. Today, laboratories must establish their own protocols for all personnel to adhere to, which include the amount of urine volume used to prepare the sediment, the speed of centrifugation, the time of centrifugation, concentration of the urine sediment, the volume of sediment examined, and the reporting format. Each of these will ensure the accuracy and precision of urine microscopic examination results at each facility. The standardized quantitative microscopic examination of urine sediment made its clinical laboratory debut way back in 1926. At that time, Thomas Addis developed a procedure to quantitate the formed elements in a 12-hour overnight urine collection. The purpose of this test, the Addis count, was to follow the progress of renal diseases, particularly acute glomerulonephritis. In today's modern laboratories, protocols have been established for all personnel to adhere to, which include urine volume used to prepare the sediment, the speed of centrifugation, the time of centrifugation, concentration of sediment, volume of sediment examined, and the reporting format. Each one of these will ensure the accuracy and precision of urine microscopic exams at each clinical facility. Standardizing urine microscopics has come a long way due to commercially available urinalysis systems. Prior to these commercial systems, we took a urine sample, we spun it down, the sediment was resuspended, and an unmeasured amount put on a slide to examine microscopically. That's all we had. Today, commercial systems standardize the techniques to prepare and view the same amount of urine sediment. To standardize the process, each system seeks to produce the same concentration of urine or sediment volume, present the same volume of sediment for microscopic examination by any individual who performs the test. This controls microscopic variables such as the volume of sediment viewed and the optical property of the slides. Some of the advantages of commercial urinalysis systems include that they're cost competitive, they're easy for personnel to adapt to, and they ensure reproducible and accurate results by all personnel. The commercial systems feature a disposable clear plastic conical centrifuge tube, and a conical tube has a V at the bottom to where the sediment will collect. A system to retain a certain volume of sample with the sediment after decanting the supernatant. This is a really important step because prior to this, we all just decanted and shook it a couple times. You may shake it 2, I may shake it 3, so the volume of sediment we were observing was not the same. They also provide microscope slides with a standardized quantity of sediment to be observed. On Table 7.1 and page 127 compares the different commercial systems that are available. This picture illustrates the COVA system. So we have the conical tube. They have a special pipette that will allow drawing up of a specific volume of the urine sediment at the bottom of the tube. The recommended specimen volume is about 12 mLs. The volumes can range from 10 to 14 mLs without affecting the components of the microscopic exam too much. You want to transfer the urine from a well-mixed specimen so that all the formed elements that are present will be resuspended. If 6 mLs of urine is used, all numeric counts must be doubled to compensate for the decreased volume of urine used. When the volume used is less than the desired volume, a notation must accompany the report. The protocol must be developed for samples less than 12 mLs. Ideally, the same centrifuge should be used each time for all urine samples. Centrifuge at 400 to 450 Gs for 5 minutes to ensure uniformity. The relative centrifugal force, RCF, used is not dependent upon the centrifuge used, whereas the revolutions per minute do vary depending upon the size of the rotor. Doing this allows for optimal sediment concentration without damaging the formed elements. Do not use the centrifuge brake to prevent resuspension of the formed elements, which will be lost during decanting. Control materials must be handled the same way as the patient samples, and this will allow detection of changes. Perhaps if you don't get enough of the elements, the formed elements, perhaps the centrifuge needs to be recalibrated. After centrifugation, you want to remove the sample very carefully from the centrifuge and concentrate according to the lab protocol. Commercial systems will retain a specific volume of urine after decanting. Do not intermix tubes or pipettes from different commercial manufacturers because they are different. These are two examples of standardized slides that are used to view the sediment microscopically. If you look, there's 2, 4, 6, 8, 10 different parts of the slide where the urine can be examined. And they already have a built-in cover slip, so you don't have to worry about cover slipping the sample. And you use a transfer pipette to fill the chamber by capillary action. Glass microscope slides and cover slips where we dump a little bit of the sediment on there are no longer recommended because they cannot yield standardized, reproducible results. The laboratory procedure needs to be followed exactly. The same microscope should be used for all urine microscopics. If not possible, then the diameters of the field of view must be identical on all. The urine components assessed using at least a 10 low power field or 10 high power fields, depending upon the specific component that you're looking for. Red blood cells, white blood cells, and casts should be enumerated. You actually count the number of them in each field. Crystals and bacteria are assessed qualitatively using a 1+2+ system. And again, you will be trained on the quantitation of formed elements at your specific laboratory and how to report those out. Some laboratories will add stain to the sediments, others will not. Supervital stains do enhance the visualization of some formed elements. The most common is crystal violet and safranin, also known as the Sternheimer-Malbin stain. Toluidine blue stains the various cell components differently to help in identification. Acetic acid is not a stain but brings out nuclear detail of white cells and lyses the red cells. This is very helpful when you have a red cell count that's too numerous to count. It's packed. You cannot see any other formed elements. By following the procedure and adding acetic acid, the red cells are lysed, thereby allowing you to visualize other formed elements that are present. Fat stains such as Sudan 3 or oil red O identify fats inside cells or free-floating. Cholesterol does not stain and must be confirmed with polarizing microscopy. The following stains are not used in routine urinalysis laboratory but may be performed at reference labs. The Gram stain, these are used primarily in microbiology to identify bacteria and yeast. They're rarely used in urinalysis. Prussian blue stains iron and hemosiderin granules, blue. These can be either free-floating or inside the cells. And the Hansel stain is a methylene blue and eosin for identification of eosinophils. There are different types of microscopy techniques that can be utilized to examine urine sediment microscopically. Bright field microscopy is the most commonly used. Phased contrast is ideal for urine sediments. This allows more detailed visualization of translucent or low refractal components and living cells, but they're more expensive. Polarizing confirms the presence of cholesterol, which forms a Maltese cross pattern with polarized light. This is also used on a variety of crystals. Interference contrast gives a three-dimensional image, but the high cost prevents use by most laboratories. This presentation will focus on the most commonly encountered formed elements found in urines and correlate the findings with the clinical significance. For example, what is the disease or condition that is found in? A few abnormal formed elements will be discussed during this presentation. Review your textbook for more detailed information. The expectation is that if you are unable to recognize the formed element, that you will seek guidance from an experienced colleague. It takes a while to learn what's an artifact and what is something that may be clinically significant and should not be ignored. You will be expected to identify formed elements either in pictures or under the microscope. As you go through the text, cover the picture and identify the structure. This is a good way of retaining that type of information. There are also many resources available on the internet to familiarize yourself with these formed elements. It's very important that urine microscopics be performed as soon as possible because some formed elements will deteriorate and disappear upon storage. They originate throughout the urinary tract or from contamination. Not all formed elements indicate an abnormal or pathologic process. The presence of large numbers of abnormal formed elements is diagnostically significant. For example, you saw 2 to 3 WBCs per high power field. Well, that's not really clinically significant. Now, if you saw 30, 40, 50, 100, then that's indicative of, that's diagnostically significant. The technologist must be familiar with the normal ranges of each component found in a urinary sediment. If you go from place to place, job to job, this will drive you nuts because every laboratory may have a little bit different way of enumeration of the formed elements. So you need to familiarize yourself with the policy at your institution. During the discussion, have your textbook handy to assist in recognizing key characteristics of microscopic elements detected. Students have a tendency to compartmentalize, meaning they do the chemical examination and they have all that done and they know the clinical significance, and then they do the microscopic exam and they know the clinical significance. But it's very important that you put both of them together. For example, if red cells are present under the microscope, you would expect to have a positive blood on the chemical examination. For WBCs, you would expect a positive leukocyte. If bacteria are present, you would expect nitrites to be positive unless it's not a first morning urine. And pH is really important when you get to crystals. Some crystals form in an acid pH, some crystals form in an alkaline. So put it all together and make sure it makes sense. Certain formed elements are found in certain disease states. Given a set of results, both chemical and microscopic, certain assumptions can be made about a potential diagnosis. For example, the presence of blood, leukocytes, nitrites, and bacteria are the hallmarks of a urinary tract infection. Here are the reference intervals for microscopic examination. In other words, these are things that may be normally found in a urine. The urine sediment consists of all of the solid and insoluble material suspended in the urine. Again, it's prepared by centrifugation, and the microscopic elements of the urine include the following, but they're not limited to red cells, white cells, epithelial cells. There's 3 types you will need to memorize: cas, bacteria, yeast, parasites, sperm, mucus, and artifacts, hair or lint, for example. The examination of urine provides information to the physician as to the patient's overall well-being. The microscopic exam is dependent upon the results of the physical and chemical examination of urine samples. Clinical laboratories have within their procedure guidelines as to when a microscopic examination is performed. For example, if a patient has a cloudy urine with a positive nitrite and leukocyte esterase, a microscopic examination would automatically be performed. What might you find in the microscopic view of this urine? Probably bacteria and white cells. The Clinical Laboratory Standards Institute, CLSI, is a nonprofit global organization that develops and publishes standards and guidelines for the healthcare and medical testing community. By CLSI guidelines, a urine microscopic is warranted if the doctor specifically requests it, if the urine has abnormal physical characteristics, or specific chemistry that is positive. The criteria for when to perform a urine microscopic will vary slightly from hospital to hospital, and that's dependent upon the pathologist. This is some of the examples of correlation between the physical and chemical results of a urinalysis and the microscopic elements seen. Please review the correlations on this slide between the tests and the possible observations. So you put your sediment on the slide and now you're ready to examine it. You want to focus on the low power objective first, your 10x ocular or your 10x objective, and scan at least 10 to 15 fields on low power. Following the urinalysis reporting guide provided with this course from your laboratory exercises, you will enumerate the casts on low power and quantitate the mucus. If you focus correctly at this time, you may see red cells, you may see white cells, and you may even be able to categorize them: the neutrophils, the eosinophils, lymphocytes, monocytes, and macrophages. Once we have completed our task on low power using the 10x objective, you'll then switch to the high power objective. This is the 40x objective on your microscope. When you multiply the ocular power of 10x by the objective power of 40x, the image is magnified 400 times. We enumerate the red cells, white cells, and all types of epithelial cells that are present. We also quantitate the crystals, bacteria, yeast, and parasites. Always correlate your microscopic findings with the physical and chemical dipstick results. When urine sediment is allowed to stand and not examined right away before reading it under the microscope, the following may happen. Red cells may become distorted and they may swell, look like a gumball, or crenate, and they may even disintegrate. White cells will disappear in an alkaline urine, a pH greater than 7. Casts will disappear in alkaline urine. Bacterial growth will increase the pH of the urine. There may be an increase in the precipitation of crystals, especially the amorphous crystals. When urine begins to cool, the crystals precipitate. This is the end of part 1 of this lecture series.